Hi, my name is Ian Harris. I am Professor of Orthopaedic Surgery at the University of New South Wales, and I'm here to tell you about the ARC study. I'll be explaining what the study is and why it is so important. The ARC study, or Australian Rotator Cuff study, is designed to find out if surgical repair of a torn rotator cuff in the shoulder is better than not repairing the tear in people with shoulder pain. Degenerative or wear and tear type tears in the rotator cuff are very common, particularly as we get older. But many people with rotator cuff tears don't have pain, and many people with shoulder pain don't have rotator cuff tears. This means that when people have shoulder pain and a rotator cuff tear, it's hard to tell how much of the pain is coming from the torn rotator cuff. Rotator cuff tears are usually not treated with surgery because the pain and weakness normally improve over time. In people who do not improve, though, surgery to repair the tear in the rotator cuff is often performed. However, not only is the surgery associated with complications, such as failure of the repair, it's not clear based on the evidence that we have so far that surgery makes the shoulder pain or function any better than not operating. In 2019, a rigorous review of all the studies that had been done comparing surgical repair of the rotator cuff to other treatments, like exercise programs, found that there is fairly good evidence that surgery doesn't improve shoulder pain any more than treating the shoulder without surgery. However, comparing surgery to other treatments is not always fair because the patients are not blinded. This means that they know what treatment they were getting. The fairest and most scientific way of finding out if surgical repair of the rotator cuff is effective is to do a study where half of the patients get their rotator cuff repaired and half of the patients don't, and where all patients are treated exactly the same in every other way, and where the patients and their doctors and physios don't know what treatment they got. That way, the patient's reporting of their pain and function is not influenced by their expectations or the expectations of those treating them. It is now recognized that this is the study that needs to be done to answer the important question about how effective this surgery is. The ARC study will be the first study of this type, testing rotator cuff repair surgery in the most scientific and fairest way possible. Patients will be carefully selected by shoulder surgeons based on having the right type of rotator cuff tear and being the right age. They will be informed about the study, contacted by the research team, and given time to consider their options. People who consent to participate in the study will all undergo arthroscopic or keyhole surgery on the shoulder, which may involve procedures to fix things other than the torn rotator cuff. All of these other procedures will be performed as usual, but when it comes time to perform the rotator cuff repair, patients will be randomized according to a computer program that will decide by chance whether they will have the repair performed or whether the surgery will stop at that point. Apart from this one thing, the repair or non-repair of the rotator cuff, patients in both groups of the study will be treated exactly the same. They will have the same follow-up and the same physiotherapy exercises afterwards. The patients, their family, their follow-up doctors, and their physios will not know which group they are in. The surgeon following the patient after surgery will be different to the surgeon who performed the operation. Even the researchers who will be calling the patients from time to find out how they are going will not know what treatment the patient had. Once we have followed up the participants over time to see how they recover, we will compare the recovery between those who had their rotator cuff repaired and those who didn't. This way, we will be able to find out which treatment is best, or if there is no difference between them. Whether you are a health worker, researcher, or patient, by participating in and helping the ARC study, you will be making a valuable contribution to generating new knowledge that will guide the treatment of this common condition for future patients. Thank you.